This conference will now be recorded.
Okay, I got the recording now. Okay, the Council on Quality Leadership is a national accreditation organization that is really the lead organization in services to persons with intellectual and developmental disabilities in terms of continuing education, accreditation, and setting the standards by which care should be provided. Um, Through this grant, we contracted with the CQL leadership, and we're having a series of seminars. Some of you have maybe taken some of the seminars, um, and some of the seminars will be repeating themselves. So if you did take it once and you have other staff or people that you would like to have attend, please go ahead. Um, just real briefly, July 9th from 9 to 1 is exploring communication. Then tomorrow on the 18th, and then again on July 9th, the three E's, the foundation of informed choice, and that's an excellent class on as individuals that you're serving are making more choices in their lives, making sure that those are informed choices and they really have knowledge and understanding of what that's all about. So I would strongly recommend that class if you haven't taken it yet. There is Everyone Has Rights coming up on May 14th. Again, good class. There's a lot of research that shows that the more you give clients the ability to make decisions about their lives, and the better behavior is in your facility, the more cooperation, the better the independent living that the client achieves, that there's a lot of very positive outcomes to letting people have their rights. And then on May 30th and September 19th, community building connections. This is all about as we move to the working on getting individuals more out into the community. How do we make connections? Because it's one thing to take someone out into the community, and it's another thing to have them actually make connections to the community. As I've mentioned before, we can all go to the Valley Plaza and you see groups of clients walking through the plaza and stuff. And so someone said, well, that's a community outing. We took clients out in the community, but who did they connect with? Who did they talk to? What meaningful involvement did they have with the community as a whole? So this is all about how do we make those connections in the community. And then on the 13th of June, embracing the dignity of risk. And again, as the individuals we serve say, I want to do something, and historically, we might think, well, no, we can't let them do that particular thing because there's a certain amount of risk involved. Well, guess what? It's their choices, and we need to really work with them, but we also want to minimize the risk. So if someone says, I want to start using the public bus, how do we go about making sure that they understand what's good about taking the bus, what potential hazards, risks, how to keep yourself safe while you're riding on the bus, how to make sure you get to where you're going, and not end up lost someplace. A lot of factors go into that, and so this is a class that really talks about how you can work with people on allowing them to take more risks in their lives. And then finally, we're offering 2 more times. We've already offered it once, person-centered thinking, both on June 25th and on September 10th. This is just an introduction. It's a 4-hour course. Some of you may have taken the course that's offered by Kern Regional Center, and let's see, Shannon Luke and John Noriega are putting on a course there, and that's a 4-day class, and it's a fairly comprehensive class on person-centered. So this is just the introduction, a 4-hour class, but it's well worth taking so that you can really understand person-centered planning. About a week ago, I was on a webinar put on by the CMS, the federal government who operates the waiver program. Well, California implements it, but the feds are the ones who've developed it. And one of the things that they talked about throughout was how person-centered planning is basically the foundation. So all of the stuff related to home and community-based waiver is based off of the fact that the plan is developed by the person, for the person. And so this is a good place to get that information on what that's all about and what you can do to make things more person-centered for your clients. Let me see. There we go. All right. And then on June 10th through the 13th, there will be a conference on different days with Dr. Tom Pomerantz. So Dr. Pomerantz is a nationally recognized authority, trainer, clinician, consultant in the field of people with disabilities. He's got over 57 years experience, and he's conducted national and international conferences, combination, it says here, information, humor, passion, storytelling, and it's really a good course to take. What it's going to be is on June 10th, 11th, and 13th. It'll be an all-day course. Take it once, so you don't have to. And it'll be a 6-hour course, including lunch. And then on the 12th, there's going to be 2 4-hour classes, and those are going to be designed for the people that we serve and their parents and folks in the community who would like to get a better understanding. But the 10th, the 11th, and the 13th will be primarily for professionals. The focus is going to be on employment-related issues, because much of the home and community-based waiver talks about that individuals should be served in the community and hopefully in employment during the day. And California has also been designated by our legislature to be an employment first state. So that means young adults, especially who are coming out of the high school system, should really be looking at work first rather than adult day services. So instead of going to a day program during the day, they would go to work, and that work could necessarily be sometimes evenings and weekends and other times, but really work is the direction we want to go. So Dr. Pomerantz will be coming to address those issues, and it's really well worth it. You get it's free. Normally his presentations, there's a charge involved, but a separate grant, not the Bakersfield ARC grant, but a separate grant that I'm working on as well, is going to be providing this training. And so I would really strongly encourage you to attend. A newsletter went out last week, and in the newsletter there was a link to the registration, and we will be sending out additional information again with the registration dates, and you can go ahead and sign up for the class. Class will take place over in the Malibu room at Kern Regional Center. So look forward to seeing many of you in person. So I would encourage you to think about the Tom Pomerantz presentation, just one day. Okay, before we get started with this, I'm just wondering, now Regional Center has done a little over 50 of the assessments on community care facilities, on day programs related to home and community-based services. Have any of you had your assessment? And if so, would you like to share a little bit about what that was about? Because altogether it's about 175. 50 plus have been done so far. So about a third of all the assessments have been done. All of them have to be done by August 31st of this year. And so anybody want to speak up about their experience with a home and community-based waiver service assessment by regional center staff?
Mars Group had all of our Bakersfield ARS assessed. I believe it was very successful. We
Okay,
had we
I'm assuming
had
that some of you have had those, and hopefully they've gone well. And if you are going to be, if you haven't had it yet, regional center should be reaching out to you with dates and times for the assessment. There is some planning right now, and if it is implemented, a third party will be doing some of the assessments, which will include
Jeffrey.
myself, and in lieu of a regional center doing it. But that's, again, it hasn't started
Jeff,
yet.
can you hear me?
Okay, this was something that the Association of Regional Centers put on their website, and then Kern Regional Center adopted it and put it on their website. And it is what person-centered planning in theory is supposed to be, not necessarily how it's actually implemented. But if you start in the very middle, which is where the three individuals are, and you work your way out, these are all the things that's involved in a good person-centered plan. You're talking about
Jeff, are you able to hear that?
well, there's obviously documentation, there's advocacy, training, education. You're working with diverse communities. You've got crisis support, nutrition, dental, transportation, housing, hygiene, safety, social skills. Some clients end up in the court system who have challenges that way, medication issues, healthcare, purchasing. And then if you go out from there even, it gives you more areas that skills and attributes that are involved in planning. So you can see it's a very complex system that we work in. And I think that what we have sometimes is, as it currently stands, the funding doesn't provide for enough service coordination. And so some of these steps get left out, or you have meetings that are an hour or an hour and a half, and then you receive a plan that talks about that where the individual is going to be receiving their services, that their health going to be maintained, and they're going to live in this home. And it really doesn't get into all of these finer areas that are involved in the planning process. So this is an ideal of what we strive for in terms of a system that is meeting the needs of the people that we serve. All right. So let's talk about some of the areas. That's what I was going to do today. Let's see. First of all, healthcare. And there's my friend, the Band-Aid, walking through the slide. And for physical care, some of the challenges that we have with the individuals that we serve are, in many cases, they are poor reporters, so that they have a difficult time doing or sharing what's bothering them. So some people, they're in pain, but they don't really know how to describe it, or they don't, or they have a concern about something going on, but they really don't share it with anyone, or because of language, limited language skills, have a difficult time expressing that. So it's up to you as a direct support professional or administrator or someone that's working with that individual, in many cases, to try to figure out what it is so that you can assist the healthcare provider in diagnosing the issue and coming up with treatment. Another issue that is related to our the people that we serve is that many of them are sedentary, that they're not out and active and really doing a lot for themselves. In my April newsletter, there was something in there from the American Heart Association that says Get Up and Move Month. This is April's Get Up and Move Month. It's totally about getting up, doing physical activity as much as possible. I just read a study last week. I read it that where they took a group of individuals who had or who have Down syndrome and had one group do walking like 4 times a week, I believe, and the other group just did their normal activity. And then after 8 weeks, when they gave them a cognitive test looking at some of their abilities, the group that had been walking throughout the week scored significantly higher on the test than the group that did not, based off of their initial scores that they did as a baseline. So the study was saying that they feel like, getting people up and moving really did benefit them cognitively, so their mental ability. Personal hygiene is important for a number of reasons. Socially, if we're have someone in our facility who's not clean and maybe smells and what have you, then people are not going to want to be around them. They're not going to necessarily want to socialize. There's also some real issues of bacteria and other things, viruses that can occur related to poor hygiene. During the height of the COVID pandemic, they kept telling us to continually wash your hands or to use a sanitizer throughout the day. Washing your hands, if you're using just regular soap, it doesn't have any antibacterial quality to it. But what it does is you have oils on your skin. Your body's constantly producing oil. And the soap takes that oil off. And anything that was sitting on that oil, i.e. the bacteria or the virus, goes down the drain with the soap. So, washing regularly, brushing your teeth, doing other things really do make a big difference in terms of how we feel about ourselves, how others feel about us, and about our health in general. Physical changes, as we age, things change. We're not the same at 50 as we were at 20. And not only does it change in terms of our stamina, but also things like if we're taking medications, our ability for our body to break down that medication and the effects that that medication may have on us. It can be different at different phases in our life. Lifestyle issues. This is becoming more and more of a item of concern, that we want to make sure that we're respectful of who the person wants to be and how they want to live their life. And sometimes that can be alternative methods or styles of what they want to do. And that's up to the individual. Again, if we're doing personal centered planning, then if someone chooses a non-traditional lifestyle, then that is something that we want to respect and to dignify. Dental services, extremely important. The mouth is part of the body. Back in 2008, when the major recession occurred, one of the things that the state of California did to balance its budget was, for a few years, it cut out Denti-Cal. So you couldn't get dental services under Medi-Cal. Because at the federal level, dental services are optional, and California always did it. So they said, okay, well, we don't have to do it, so we're not going to do it. But I thought that was really short-sighted. There are, for example, endocarditis. I'm not sure I'm pronouncing that correctly, but anyways, it's a disease where bacteria travels from the gums to the heart and can cause major damage to the heart valves. So, dental hygiene is important because, again, just like personal hygiene, if someone isn't brushing or flossing or cleaning their mouth well, there can be a lot of sometimes odors. There can be gum damage, bleeding of the gums, recession of the gums. They can lose teeth, and then that can make a difference in terms of their appearance, how they present, their speech if they lose teeth, and other things that can be related to that. And then medications. Many of the people that you serve are taking multiple medications. And so those medications need to be assessed by a medical professional. Sometimes you can talk to the pharmacist when you go to pick them up about that to make sure they're looking for benefits. And sometimes there's also are side effects, so that a particular medication may cause, let's say, for example, drowsiness or dry mouth or constipation. And so we need to be aware of that and to be looking for that with our particular clients if that's the case. So, is that a medication still needed for that individual? So that's where you work with your physician and also your pharmacist to make sure that the medication that an individual has been placed on continue to be the effective for that person and should be reevaluated with some frequency to make sure that that's the case. But just as an example, if someone's taking a diuretic and for, let's say, for blood pressure or some of the newer medications for diabetes, then they need a lot more fluid intake. Or someone who has constipation might need more fluid intake, and maybe some fiber-related issues. Again, I'm not a physician, I can't say specifically, but again, that's where you talk to the folks and find out what the indications are for that medication and what are some of the things that you should be looking for, and remembering that the individual themselves might be a poor reporter. You need to sort of keep an eye on what's going on with them to make sure that they're getting the care that they need. Okay, health. One of the things that we oftentimes don't talk about with our clients is sexuality, and our individuals are adults who have the same rights and hopefully the ability and opportunity to have relationships, social competency, and there's a lot that goes along with that. Kern County has some of the highest rates of sexually transmitted diseases anywhere in California. And so with someone wanting to have relationships, we also want to make sure they have an understanding of what relationships are all about, both socially and and what are relationship skills. And for example, consent. No means no, and other things that are related to what is a proper relationship and how to do that, and including providing privacy for individuals within your home if somebody wants to be in a relationship. Important also is female and male health. Are your women clients receiving the breast exams, gynecological, pap smear, other sort of exams related to as they age consistent with the health standards. For males, are they receiving a testicular and prostate exams and the things that are necessary for their health? You know, I've had a couple of different stories over the years where I've seen where physicians, because of the fact that someone has an intellectual or developmental disability, don't necessarily want to get involved with their male and female healthcare. A number of years ago, I talked to a provider who shared with me that when we were doing health stuff, that her individuals had never seen an OBGYN, and these are women that had lived in their home for a number of years and should have been getting the regular screenings. I said, well, talk to your primary physician, have your primary physician give you a referral. She went to the primary physician, and when I went back the next time and asked her, she said, oh no, the primary physician said no, because he didn't think they should know what's down there, and if they knew what was down there, they might want to use it. So that was not a good decision in terms of their autonomy, their health, their ability to have relationships. And something similar recently, I just heard of a male, and the provider wanted the individual who was in their 60s to have screening for prostate cancer. And it can be done a couple of, and the doctor said, no, I don't want to do that, because if I do it digitally, that will be uncomfortable for him, and then this individual may not want to be as cooperative the next time he comes into my office. And in addition to that, I don't think I want to give him a colonoscopy, because that's a very challenging procedure, getting prepped, and I'm not sure he can do it independently or with assistance, and therefore let's just skip that too. So here was an individual who lost out on 2 important health screenings for cancer that he potentially should have had. So, and then we want to make sure that we're teaching abuse prevention. How do we make sure that the people that we're working with understand that, what is abuse, how to prevent it, how to report it? For the people that we serve, the number one type of abuse is from persons who know them. So it's a family member, the bus driver, somebody that works in the program, a neighbor, a DSP in the home, someone, and oftentimes what our individuals who are being abused are told is, don't say anything, because if you speak up, there's going to be trouble. So the individual, because either they may not know that they were being abused, or because they were told not to speak up, don't say anything for some period of time until maybe the provider notices bruises on their thigh, or some other issue related to what had occurred. And by that time, it's too late, because they take them to a specialized health clinic to get a rape kit done, to see if there's no sample left anymore. It's been too long of a period of time, and the clothes have been washed, the person's bathed. And unfortunately, our individuals don't always make the best reporters, so they are more subject to abuse. So talking to people about what is abuse and prevention of it is an important step that we can take towards making sure that our clients can have relationships, and yet those being healthy relationships that have to do with who they are and their personal health, their sexual health, their psychological health related to all of this area. Mental health, counseling and psychiatry is a challenge. Most mental health professionals were taught about psychiatric disorders. So anxiety, depression, bipolar, maybe some of the personality disorders, etc. There isn't a lot of training on persons with developmental and intellectual needs. So for many years when I was in the field, I would hear from mental health professionals, oh, this person can't have a mental illness because they're cognitively delayed. And so they really, the two, you can't have both. It's one or the other. And that's not true. And you can indeed have significant mental health challenges as well as a developmental disability. The statistics actually show that it's about the same in the population for persons with developmental disabilities as is for the general population. I just read an article yesterday. It was talking about adolescents with autism, and it talked about the high number of them who have contemplated suicide. And yet that's not something that, we normally are, counseling. We're not providing psychiatric services. Oftentimes too, psychiatric services are primarily used for medications and medications that are an attempt to deal with challenging behavior. So for individuals who maybe are aggressive, tantruming, acting out, destruction of property, other things, sometimes people end up in a psychiatric situation and they're given medications with the attempt to calm them down, which are, maybe that's a good call. I'm not saying yes or no, but sometimes it's done more as for sedating than it is for actual treating of the psychiatric disorder, and that's not really what we're supposed to be doing. Some people have in the past sometimes called that a chemical straitjacket. So we want to try to avoid using medications where they're not really. That's not the primary indication for that medication. There is a manual that is out there. There's an organization that is specifically geared towards individuals who have both intellectual disabilities and mental health challenges, and it's a diagnosis manual. And it basically goes through all of the mental health diagnoses and has a thing along the side that says, and this is how you would see this mental health diagnosis in people with intellectual disabilities. So for example, it talks about depression and says this is what you would see in the general population depression. It would say, and these are some of the specifics that you might see in a person with a developmental disability. So it really attempts to bridge the two. So you can see that, but it's hard to find a lot of professionals out there in the mental health field who are well versed in also working with our population. Okay, one of the other areas we really want to start focusing on is life skills. Because as we talk about people having greater independence, one of the things is how well do people get along with other folks? There was a study that a number of years ago that looked at persons with intellectual and developmental disabilities in the workforce. And is that manual available? Yeah, I can send out information about that. It costs $90 for the manual. You buy it through the mental health. I'm trying to think of the name of the organization. I'll find it, and we will. If you want to call Irene at Current Regional Center, I'll give her the information. Organizing skills. Think about this. You get up in the morning. What do you think about doing? Well, today's Wednesday, right? What am I doing today? I'm gonna get up, I'm gonna get dressed, I'm gonna take a shower, get dressed, gonna get breakfast on the table. If I've got children, how am I getting them off to school, or if they're adults living in my home, what is their program day to day? Working? Are they going to the day program? Is someone staying home or has a doctor appointment? So you're organizing your day from the moment you get up in the morning and throughout the day. I use my iPhone and the calendar in there, and I put everything in there. And when I get up in the morning, what's the first thing I do after I use the restroom? Is I get up and I look at my phone. Unfortunately, I mean, we're sort of attached to these things at the hip, and look at my day and see where I'm supposed to be and what am I doing, and do I have a lunch appointment? Do I have, and then you're thinking about things like, okay, well, for dinner tonight, what am I going to do? So you're always constantly trying to keep your life in some organization. Some people are better at this than others. Some people are very organized. Some people are not as organized, but there's that part of us. Think about it this way. If you went to Mechanics Bank Arena to see the Bakersfield Philharmonic Orchestra playing, and you notice that there's a conductor up in the front, and he or she is, swinging the baton and using their hands, and is keeping everybody on task. If that conductor wasn't there, within about a minute or two, the wind section would be doing one thing, the percussion section would be doing a different thing, the strings might be doing something else. So that's what that part of our brain, it's a frontal part of our brain, the front part of our brain, it's the prefrontal lobe does, is it keeps us organized. So we understand. Many of our individuals have not sort of been encouraged or taught the prerequisites to doing an organized day. So we really want to try to find ways to help people organize. I've seen it from having a calendar with picture icons, and so on different days there are different pictures representing what that person's going to be doing for that day. So when they get up in the morning, it'd be just like my iPhone. They'd look to see what their organization skills are, what's necessary for that day, where they're going to go, what they're going to do. How much do people really socially understand and relationships? We give verbal and nonverbal cues all the time. If you're talking to me and I give you a frown or kind of shaking my head back and forth, that sort of gives you an indication of what I'm thinking about what you're saying. If I'm looking down or looking up or looking away, that is, again, social understanding. For a lot of the individuals we serve, their ability to understand social cues is somewhat limited. And that's one of the things we want to teach too, is how do you sort of, to the best of possible, read other people. I mean, those of you who have been in a long-term relationship know that you can never fully really understand and read other people, but you can do a pretty darn good job of getting some understanding by just looking, watching, listening. And so teaching those skills on how to be in relationships. It's not intuitive. Sometimes we pick it up over time as from a youngster, from the dating we did in junior high and high school, and beyond that, once we if and when we got married or got into a relationship with a significant other, what is it involved with that? And many of our individuals have not been taught those skills. And so as we look at trying to get them more out in the community, how do we make sure that they understand what the skills are necessary to really get a better understanding? Within that, also social understanding, if I'm talking to you and I'm getting up like within a foot or two of your face and right next to your body, and not giving you that social distance. During COVID, we all that became a big thing. Social distance, got to stay 6 feet away, because that's how far the virus can transmit. Well, but now that we're not so concerned about that, we are still concerned about, we don't want people right up against us, and so we want to teach that as a skill too. So wait a minute, you got to keep your distance. Communication difficulties, and that can be a few things. Some clients are just somewhat difficult to understand, and as they've been living in our facility or going to our program for a period of time, we get better and better at understanding it. But the community as a whole may or may not be able to really understand their communication and and so working with them to the best that we can. And that can be nonverbal communication too. It can be using a communication board. It can be using sign language. There's a lot of different ways that people communicate, but really working towards trying to get communication that is two-way. So if they're talking to someone or in a social situation, they can be part of that going on. Also within communication is voice. Some people are very loud, and it's a matter of, maybe working with that person about, wait a minute, we need to use our inside voice. This is a setting where we don't want to be really loud. Some people are too soft, you can barely hear them. So we want to try to look at, okay, how can we make it so that this person can be a better communicator? As I mentioned earlier, with the coming Dr. Pomerantz coming later this year, spring, career path is becoming more and more of an issue. How do people get into the workplace? And I saw one study that said that the best indicator of how well somebody's going to do on a job placement. So if we're working to place a individual in, say, part-time or full-time employment in the community, is how well they get along with other people. So if they've got good people skills, it makes quite a big difference in terms of how well they can do the job. And so teaching people the skills necessary is really important. And then along with that comes future planning. If you think about, for those of you who have family or think about your own life, when you were growing up, people said to you, okay, so what do you want to be when you grow up? You want to be an astronaut? That's really cool. I mean, that's money. So you're going to take classes in aerospace in school and do some. Guess what? Very few, if any, of our persons with developmental disabilities have been asked what they want to do in their future. So future is really not, in many cases, part of the equation, and it really should be. So as we're doing person-centered plans, as we're talking to somebody, hey, what would you like? Where would you like to see it? If you could see yourself 5 or 10 years from now, where would you like to go? What would you like to do? I mean, I recently started a new chapter in my life where I'm now semi-retired and just doing consulting. I'm not employed by an employer anymore. So, but that came over a period of time of thinking about, okay, where do I want to be 5 years from now, 3 years from now? Yeah. And coming up with a plan that worked for me. And it took some work, took some planning, but we were able to do it. developing personal strengths. Everybody is good at some things and not as good at other things. So looking at where the person has some potential or has shown some strong personal strengths makes a huge difference. There is some research on resiliency about how people who have had major traumas, had challenges in their younger life, disabilities, whatever, and those that then went on to be fairly successful in adulthood, they looked at why is that, and they couldn't find a reason for it, but they did find two things that seemed to show up most often in why people did better. One was that they had someone in their life who was consistently there, who seemed, to give them unconditional support and love, and that could be a family member, it could be a teacher, it could be a minister, but somebody in their life that was there throughout for them. But the other one was that they were good at one or more areas, and so they had specific strengths that they could use to help them, with their self-esteem, with being successful, with navigating the world. So we really want to work towards looking at the personal strengths that people have and developing them more. Understanding problem behavior. Okay, so why is this individual having behavior that seems to be getting in the way of things? There's probably as many answers to this question as there are people who have this challenge. And it can be all kinds of different things. Now, in a horror story example from years ago, an individual who developed the habit of putting his fist in his mouth. And so they brought in a behaviorist, because it just seemed like it was not a behavior that we wanted to, it wasn't helping him with communicating, getting along with people, being out in the community, and they eventually, I guess, when he went for his annual dental checkup, it was discovered that he had a throat cancer. And the putting his fist in his mouth was sort of like a counter pressure against the pain that he was feeling, because again, not a good reporter. And so that was one situation. There are other situations where people, feel like they're not being heard, and that one of the ways to get heard is to do that. I had one young man one time who, as he was growing up, his parents sort of didn't pay attention to him, and the only time they paid attention to him was when he messed up, and then they would, give him a scolding, but that was the only attention he got. So he learned that, hey, if I mess up, if I do something wrong, I'm going to get attention, and I would like some attention. We all want attention at times. So with that individual, it's a matter of sort of looking at that learned behavior and looking at a different way of trying to get attention, and starting to work with him on, wait a minute, we did, catch somebody doing something right. So starting to give him more of the attention for what he did right and ignoring what they did wrong. So understanding problem behavior can go a long way in helping with life skills, but it's a challenge. And although I'm a 47-year professional with a license and everything else, I don't always understand problem behavior. I think it's really is something that we need to look at on an individual basis, and work with people, respectfully, and caring, understanding the best we can. Advocacy, helping people do more for themselves, to make choices about their own lives, to speak up, to not be in trouble for that. Recently, I heard of a case where somebody told their family member about something in the home, and that family member then complained to the regional center. And the next time the family came out, the client says, I can't share if anything about what's going on here in the home because the staff told me that I can't say anything to you. Well, no, that's not. The clients have a right to speak up, and we want to encourage that. We want to teach that. We want to reward that, so that people do feel that they can speak up for themselves, and then also to do it in a way that they're not going to have repercussions for doing it. And one of the things that's advocacy, that if you think about this, and if the individuals that you serve are able to, November is a very important month this year because we're having our presidential election, and we have two very different candidates, and they have very different views on services to persons with developmental disabilities, our two presidential candidates. So, maybe sitting down with the individuals in your facility, having them register to vote, and then talking with them about, wait a minute, on this particular individual sees, greater services as part of their platform. This other individual feels that less government is better for everyone. And how do you feel about that? Do you feel that, additional services is the way to go? Or do you think that government shouldn't really be in people's lives as much as it is now? So, that's another area of advocacy that's out there that you should really train your clients towards. 10:58, usually like to take this to 11. So I will open it up if anybody wants to open their mic and ask any questions or give any feedback to today's presentation. We've got a few minutes here to do that. Okay, hearing none, I would, if any of you are, like I said, are interested, tomorrow there is the CQL presentation. You can still sign up. I believe as of this morning, we had like 19 people signed up for it, and it can go up to 30. So we would encourage you to look at that with, okay, we have 20 slots left. Okay, so we have quite a few that we can take for tomorrow. And then, and also keep in track and look at that newsletter that gets sent out monthly. It's got all the dates and times, and for the trainings, we're trying to offer a wide array of trainings for you to enhance your skills as a provider, and we really encourage you to take advantage of that. And with that, it's 11:59, and I will bid you a good day and hope you have the rest of the week. And like I said, next week we will have a webinar and then also the training tomorrow. Bye-bye.